Hello friends, I hope you're all doing well out there. Today I wanted to talk about a major complication I had to endure because of my cancer and ultimately because of my radiation treatments. I hope that by talking about this I could help someone out there who's gotten the same complication due to either their cancer or their radiation treatments. Definitely gonna cut this story into two parts. This part I'll talk about the complication itself and everything leading up to it. And the next part, I'll talk about what my doctors did to fix it. So if you're new here, hi, my name is Nick. In 2016, I was diagnosed with stage 4 double-hit lymphoma. I was prescribed 6 rounds of chemotherapy, an autologous stem cell transplant, and 10 rounds of radiation. Before I was diagnosed, I literally woke up one day and I couldn't walk right. I was limping around my job and I was in a lot of pain. Unbeknownst to me, my right hip joint was full of lymphoma. And when I could no longer walk right, the lymphoma was at the point where it pushed my hip joint out of its socket and then occupied the hole. It had also began eating holes in my hip bone. Ouch. The pain would come and go. It literally felt like acid eating my bones. And simple things like getting out of my low-ass car felt like torture. I had gone to the doctor twice to get help. The first time was shortly after I acquired the limp, when the pain became unbearable. The ER doctor told me, that's probably rheumatoid arthritis. I requested a Lyme's disease test, it came back positive, and I thought that was my diagnosis. The second time I went to the doctor, and this was my primary care doctor, she looked at my protruding stomach, full of lymphoma, and she said, "Oh my God, you're pregnant! Take this into the bathroom right now." But take it into the bathroom right now. I'm sorry, I know I've told that story before in my diagnosis video, but I'll never get over it as long as I friggin' live. Needless to say, I never saw her again. She also told me to wait until my pending health insurance from my job went through. Never put a rush on getting a scan or anything, even though she felt my stomach and looked horrified. But anyway, this video is not about her. It is about me always being the just deal with it type of person. Any kind of slight inconvenience to a major pain, I always told myself, it'll pass, just deal with it. Literally nothing used to bother me. So I walked incredibly fudged up, dealt with this pain, knowing deep in my soul that I had something very wrong with me, that it was probably something serious like cancer. And that's not even a joke. The pain was so bad and the things that were happening to me were so bizarre that I knew it was something serious, and I knew deep down that I was probably dying. But being in my early 20s, I was scared, I was an idiot, and I was also going through problems in my relationship at the time. And I thought it was the end of the world anyway. So I just dealt with it until I almost let my cancer kill me. Finally though, I went to see an infectious disease doctor and he told me I was very sick. He took one look at me. He didn't even want my money. He told me I was very sick and he made me promise that I would go across the street to the ER to be admitted by his practice. So a CAT scan, a bone scan, an MRI, and copious amounts of blood work later. I was told that I had a cancer of unknown type, and it was everywhere but my brain. They told me it completely destroyed my right hip joint and that my hip bone had looked quite moth-eaten. Their words, not mine. As far as my hip, my official diagnosis was a pathological hip fracture, meaning the fracture wasn't caused by an injury or something I did, but rather a disease. The main reason I was prescribed radiation treatments was because of how much lymphoma was in my bone, and my pelvis as well, since I looked like a pregnant mess. So this recap is important because had I pushed the doctors I saw to get me a scan or something, I don't think this injury would have been half as bad as it was, and I truly feel like it would have healed itself, like my orthopedic oncologist predicted it would, and I wouldn't have had to go through half of the things that I went through. And I'm telling you this because I don't want you to watch this and think, oh my God, radiation treatments are so bad. Because radiation saved my life, period, the end. I would absolutely not even think twice if I had to go through all of this again. So don't think radiation treatments are bad. It was partially, actually maybe 70% my fault that I wasn't more pushy with my doctors getting this injury taken care of. Anyway, this pathological hip fracture made things so incredibly hard for me throughout my treatment. I couldn't walk and I couldn't drive. So right away I had to leave work and go on disability. And I couldn't take myself to any of my appointments. As if my family would let me go alone anyway, come on. And because I had a cancer-related injury in my bone, I had to see an orthopedic oncologist. I will call him Dr. S in this video for privacy. Hi, Dr. S. That's nowhere close to his name, so. We're both huge fans of each other's art, and we support each other on our Instagram pages. It's one of the many amazing connections I've made throughout this whole shitty ordeal. Okay, back on track. For the first couple of visits to my orthopedic oncologist, nothing was very clear. I believe in the very beginning, he thought I would eventually need a hip replacement, which, being in my early 20s, scared the crap out of me and definitely surprised and upset me. Like, more than my diagnosis ever did. But throughout the months that I went to see Dr. S, he was watching how my cancer would respond to the chemotherapy and the radiation. And I believe he was very confused about what would need to take place himself, because my case was weird. But after a few visits, Dr. S noticed that my hip bone was kind of healing itself. And in his professional opinion, he didn't think I would need a hip replacement and that the hip would eventually just heal on its own, which was definitely good news for me. I was sick of hospitals and one less procedure was a-okay in my book. Until that is, a few months after I finished cancer treatments. I was walking on my own without pain for like a month, maybe. Eventually, a little bit of pain would stop me dead in my tracks, and I developed a little limp. Dr. S decided that I just needed physical therapy. 6 weeks of physical therapy later, Dr. S noticed on my x-ray that I might have arthritis, and that was the cause of the pain. So I stopped going to physical therapy and I became really depressed. So now I either had the choice of dealing with this pain or get a hip replacement, which I absolutely did not want to get. Like I said, I was sick of hospitals and I missed the independent lifestyle that I had since the age of 20. So I decided for now to deal with the pain and the limp, which made Dr. S believe that the pain was less than it actually was. If you're watching this, I am so sorry. It was also during this time that I adopted a lot of coping mechanisms to deal with the pain and depression. Some healthy, some unhealthy. And that's another video. But my pain and my limp only got worse and worse. And I could only hide it from my friends and family for so long. My breaking point was the last time I went to see Dr. S. He had prescribed me some ibuprofen 800s to deal with the pain and the inflammation from the arthritis. And he told me he would see me when I'm 50 for a hip replacement. For once in my life, I spoke out for myself and I became emotional and I told him that I didn't think I could deal with this amount of pain for that long. Like, you're talking about my whole life over again. I think he then realized how bad the pain actually was and asked me if it was so bad that I'd consider surgery. I tearfully said yes. After some more visits, some x-rays, and a lot more pain, Dr. S and his assistant informed me that I didn't have arthritis, that I had avascular necrosis, and he believed it was caused by my radiation treatments. Now, I'm not a doctor, but in my soul, sure, he might be right. It might have been caused by the radiation treatments. But like I said, the extent of my injury played a huge role. I definitely believe that. Avascular necrosis is the death of bone tissue due to lack of blood supply. It could lead to the bone's eventual collapse. For me personally, the pain inflicted on me from this disease was unfathomable. And I work on my feet, so it made everyday tasks like driving and getting in and out of my car, just like the cancer, horrendously painful. And it made me walk with a limp that was so severe I would get looks wherever I went, and horrified looks, not just the typical stares, which I couldn't even blame people for. I mean, it was bad. My life was completely devastated, and my only hope was a total hip replacement. But I'm gonna stop there and continue next time. Please like and subscribe for more lymphoma-related content from the eyes of a former patient and current survivor. If you've gone through a vascular necrosis as a result of your cancer treatments or your disease or anything, share your experience in the comments down below. Na zdrovia, and I'll see you on my next one. Bye. 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 Like and subscribe, or else.